This is the MGEM Center for Training and Development, the training arm of the American Chamber of Commerce. We are here to enhance, upscale, and develop employees' skills to help them reach their fullest potential. So lay the foundation towards your future success now. Since March, we have organized more than 20 e-learning sessions, supporting more than 50 companies, reaching more than 800 participants. So build winning teams through our programs available online. So what are you waiting for? Don't quarantine yourself from learning and find your path towards success with AmCham. For more information and details about our training programs, please contact us.
Thank you for joining us for today's webinar. To ensure a smooth flow of the discussion, we would like to remind our attendees of the webinar guidelines. May we request all to input their questions in the Q&A box found below your screen. Should you wish to ask your questions live, please click on the Raise Hand button, also found below your screen, and our moderator for today will cue you in. Let us keep our chat box friendly and for webinar-related concerns. Please be informed that this webinar is being recorded and recording is all rights reserved to AmCham Philippines. We will provide the presentation and recording to all attendees after the webinar. As always, we value your feedback and concerns. Please fill out our survey, which should pop on your screen after exiting the webinar. And for more information, you may visit our website or email us at amcham@amchamphilippines.com. Thank you and enjoy the webinar.
All right, good morning to everyone, and I hope you're all doing well and staying safe. It is a rainy morning here in Cavite where I'm working from home. And by the way, I am Mac Lawrence Bensal, head of the AmCham Center for Training and Development, the training arm of the American Chamber of Commerce. And I welcome you in today's e-learning session entitled Meeting Medical School Philippines Primer, in partnership, of course, with Dr. Ogan Berel, our resource speaker for today. Please note that there is more to this program that we'll be explaining later on as we go along. We at AmCham always strive to provide relevant and practical industry updates which help strengthen your business in this trying time. So thank you to all members and of course to the non-members as well for attending today's session. Since March 2020, we have conducted more than 80 online industry committee meetings and luncheon, tackling various issues related or not to COVID-19. We have also offered more than 25 e-learning courses, which were attended by over 800 participants. Now, it is very unfortunate that our executive director couldn't make it this morning, but I hope he will be present later on as we close on the program. For the interest of clarity, may I remind everyone that for questions, you may use the chat box instead, located at the bottom part of your screens, or you may unmute your microphones later on and engage with our resource speakers during the Q&A section, which will be held after the presentation. Before we begin, let's just have a quick mic test and say good morning to your classmates for today's e-learning session.
Good morning.
Good morning.
Good morning,
Good morning.
everyone.
Good
All
morning,
right. Good
everyone.
morning.
Good morning, everyone.
Hey,
Good morning, everyone.
All right. Thank you very much, everyone. Well, before we begin as well, please note that this is the first among 5 sessions of the mini medical school to be conducted by Dr. Ogan. And then we will be releasing the information to the course after this primer. Of course, Dr. Ogan will most likely dive on some parts that he will be presenting in the next session, but some key topics covers the basic, preclinical, and clinical sciences, emphasizing the main principles and logic of medicine, how doctors think, and how the healthcare system works. So, more information about that later. Now, to officially begin, Don, so Dr. Ogan, Don is supposed to be the one who's going to introduce you, but he's not yet around. So let's kick off. I'll do the introduction. I saw your profile, and I think it's going to take me around half day just to get your credentials going. But anyways,
That's fine. I can do
everyone-
it. I can do a self-introduction.
All right, is it in your presentation?
Yeah, I hope Don is okay, and certainly look forward to seeing him as well when he's able. And I want to thank you in particular, Mac, for all the very diligent and professional preparation for this session. And it's a pleasure to work with AmCham Philippines. I just saw the video as well. So very impressive work that you're doing there, very innovative work. And I should say that the mini MD or the mini medical school is not your usual program. And we will discuss why that's so. It's a very innovative program. And I give my kudos to AmCham Philippines and to you and Don for pushing the envelope, as it were, with education and so forth and training for professionals. And insofar as healthcare is such an important topic, I think this is a great opportunity for both of us. So I really appreciate that and wanted to send my thanks. By way of
Thank you
introduction,
very much, Dr. Ogan.
you're welcome. My pleasure. So we have a lot to cover today. And as Mac mentioned, this is just a primer. It's a little bit of an exposure to the mini MD, which is a full week program, half day a week, or a half day for 5 days program. And I'll go over some of that and also give you some examples of the program and hopefully some things that you can take from today that will be important in your careers and personally as well. And just very quick background, as Mac mentioned, I have a broad background globally in medicine. I'm trained as a doctor in science. I do scientific research in academia. I'm a professor. I teach innovation and other technical topics. And I also have been working with companies, startups, all the way to very large conglomerates through my career. And I developed this mini MD while I was at Samsung, actually, and I'll tell you a little bit of the story behind that as we start. So this is the mini medical school, and you're probably wondering, that's a little bit strange. And in fact, I would say that this is probably the only kind of course in the world that covers medicine in a compressed manner for the general professional public. Now, you may have heard of mini MDs, mini MBA or mini finance or mini accounting for professionals who may not be, not have an MBA or not be accountants to brush up on some of those topics. So that's actually very common. And there are many MBA programs throughout the world. And some of them are a couple of days, some of them are a week, some of them are 2 weeks, and so forth. But as far as I know, there really isn't a coherent, systematic mini medical school. And now you might ask, why should I take a mini medical school? I'm not training to be a doctor, but I'll go over some of the reasons and motivations and value of such a program during this primer. So the overall outline to this course I'm going to share the screen. Pardon me. The overall outline to this course will have three parts, or I should say to this primer, today's session, a mini MD introductory or mini medical school introductory, and then a small sample from the mini medical school, uh, not the whole program. And this is not just a 1 hour overview of the whole week program. I'll actually give a sample from the program that focuses on diagnosis. What is diagnosis? Everyone obviously knows what that word means, but in medicine and how doctors think about it and how medical systems think about it and so forth, diagnosis has a much more complex context. And then thirdly, I will go overview of COVID-19, obviously some of the medical and epidemiological aspects that I hope you will find valuable with today's session. And we'll take a short break between the first two segments, the introductory and the sample, and the overview of COVID-19. Mac had mentioned about question and answering at the end. My style is fairly interactive. So if you have a pressing question, feel free to ask that during the course of the presentation. Additionally, I may ask the audience for some input as well. And so instead of the classic seminar where you sit and wait for an hour and then ask some questions at the end, we'll try to make this a little bit more engaged, obviously within the constraints of our online format. So now to the mini MD introductory. This section is what I present at the very beginning of the course, and it presents a little bit about the motivations for the course and the structure of the course. So we start with a quote from a very famous author, Thomas Mann. He got Nobel Prize in Literature, and he writes, "All interest in disease and death is only another expression of interest in life." So obviously this is a mini medical school. It has a technical component, a professional component, again, not for doctors per se, but for healthcare professionals, whether they be biomedical scientists, pharmaceutical executives, healthcare lawyers, healthcare architects, and so forth. But in addition to the professional component, learning about medicine is, in effect, as Thomas Mann alludes, an expression of life itself. So it's a fascinating topic. It's a fascinating field. And I hope to share some of that passion with you over the course of this session and hopefully over the course of the full course. So why attend this program? I can isolate three major reasons. One of them is curiosity. Health, wellness, and medicine are always of great perennial interest, whether it be yourself personally, your family. You may not be biologist, of course, but I think everyone has a fascination with how the body works and, of course, how it doesn't work. And so this is a general motivation for the program, a personal curiosity. A second one is to communicate effectively with clinicians, namely doctors, nurses, etc. So if you're a healthcare architect designing a new hospital or a healthcare lawyer working with a physician-driven startup for some patents or contracts, or you're a healthcare consultant, or you're a med tech executive, etc., anytime you're engaging with the healthcare system, you need to communicate effectively with clinicians, specifically physicians and doctors, of course. And so there's a big gap between that. And so often people view medicine and what doctors do as a black box. And it can be, to be very frank, threatening or mysterious. And part of this course is to reduce that mystery and to enable effective communication with clinicians. So this is really important in ideating, developing, commercializing, doing business, new healthcare technologies and services. Working with clinicians is absolutely critical. And often there is a big gap between those two groups. And this course, even though it's quite short, is designed to bridge that gap. And I think that's a very powerful goal. And then the other is to understand medical needs more clearly and deeply. So if you're developing new technologies, developing new markets, developing new science, whatever the field is that intersects with medicine, to understand the wider context of medicine and healthcare is critical to effective innovation and implementation. It's more than just, installing a refrigerator or a logistics pathway or whatever. These are all complex things, of course, but medicine is a whole category by itself. It's one reason why there are no mini medical schools out there. It really is its own beast, as it were. And so we want to prick that mystery and help bring greater understanding to help develop markets, develop technologies, and ultimately, speaking as a doctor, to help people and patients. Now, here's a personal story. This course may even someday save your life. I know that sounds strange. I'm sure many of the AmCham seminars, outstanding as they are, haven't actually advertised themselves as potentially saving your life. But I'll give you a personal story. On May 7th, 2018, I actually had some chest pains, and the progression of that to the neck and to the jaw was very concerning. Obviously, I'm trained as a doctor. I was able to very quickly recognize that this was not your usual chest pains or whatever. I had never had this pain before. And I went downstairs, called an ambulance, and this is my EKG in the ambulance that shows that I was having a heart attack. That's me in the hospital. This is my blood pressure, actually fairly low. On medicines, and this is me being taken to the cath lab. To make a long story short, I got and still have, of course, 2 stents. And then this is the doctor who inserted those stents. And this is me less than 1 year later in Kazakhstan at Almaty. I'm finishing the marathon, and I ran a marathon and finished that in, you can see here, 4 hours, 57 minutes, not very fast. But if you think about it, less than 1 year after a heart attack requiring stents and intervention, that was a very good accomplishment. And I attribute some of my survival, of course, much of my survival, of course, to Dr. Kang and his colleagues. But to be frank, some of that is due to my own knowledge, my own awareness, and understanding that this was not a trivial matter, and I had to go to the hospital right away. So what will you achieve with this program? First of all, obviously, the most direct benefit is a knowledge base. This is an overview of all the topics that medical students learn over 4 years. Now, that may seem incredible, but I think you'll see from this primer that that will be possible. Second is this cultural awareness that I mentioned, understanding the logic. So this is more than just knowledge. I'm not going to give a whole bunch of facts. In fact, it's in some ways better than medical school. Medical students have to memorize all sorts of facts and so forth. This is more the conceptual framework and the logic, which is not always efficiently taught in medical school. And so understanding that logic, and sometimes the lack of that logic, and again, I'm not imputing anything negative, but medicine is not perfect, that doctors use. And so understanding that is extremely important. And then the most important actually is a framework for further understanding. Obviously, in a short 1 week mini medical school, we can't cover everything in detail. But more than just providing the facts is to develop a conceptual framework so that if you Google something, or if you talk to a doctor, or if you're trying to look in more detail at some topic, you have a framework, a powerful framework to really understand it. You know, people might say, why do I need to take a mini medical school? I'll just Google something as soon as I get a symptom or as soon as I hear about a disease, and then the Wikipedia and so forth. And these are not bad sources. I'm not saying, of course, there are some bad sources out there and misinformation and so forth. But what I'm saying is, if you don't have a framework, all of this is just random facts. You have no way of really leveraging that and processing that. And so this provides that kind of powerful logical framework based on a core element of knowledge for really understanding healthcare and medicine. So how are we going to do this? The process is very important. First of all, it's a kind of immersive process. This primer session is relatively short, maybe an hour and a half. But here I talk about an overview in 2 days. By the way, it will be stretched out over a week because the online format is a little more challenging. But it's an immersion in one whole integrated perspective. And that's a very unusual thing. Even medical students don't get that. They get everything stretched out over 4 years. The other thing I would strongly recommend, if you take the program, is this is a unique opportunity to ideate, to think of new ideas. You're being presented with all of medicine in the course of a very short period of time. And if you have a notepad next to you, you can think, oh, I have this product, or I have this service, or I work with this company. Maybe this is a new market, or maybe this is a new idea. This is an opportunity to bring your own background and experience. And many of you are in healthcare, so you certainly have quite a lot of knowledge to discover new ideas. So it's an ideation platform. Think about it as your personal brainstorming system. And then the other thing is to experience it. It's a very intense program. Obviously, it's modified in terms of being stretched out for online. Nobody can listen to a Zoom call for 8 hours, but I've taught this course 8 hours, 9 hours each day to participants who really involved in that. So that's kind of what it means to be a doctor. You're committed to your patients, 24/7, the intensity of it and the ideas and the discussion. This is the kind of experience that touches upon what doctors experience. And that kind of experiential quality is also very important. So I've taught this course around the world, in Korea, where I'm based, in Southeast Asia, in particular in Singapore, in Australia, in New Zealand, in the United States, and in Italy. And it's garnered hundreds of testimonials, and here are some. This is Heather St. John from Melbourne. This is Adam Chi from Singapore. This is Linus Lam, also from Singapore. This is Andrew Phelan from Australia. And this is Mark Ketzel from California in the United States. Dozens of testimonials that you can find on my LinkedIn profile, and Matt can share with the course materials. So what do we learn in the course? Well, we cover, as I mentioned, medical school in the American model is 4 years. So we cover the basic sciences, years 1 and 2. And this can be split into two parts: the basic sciences, which is anatomy, physiology, biochemistry, and then what we would call the preclinical sciences, which are neuroscience and microbiology, immunology. Obviously, microbiology and immunology are very big these days with COVID. Pathology, the study of disease; pharmacology, about the drugs and medicines; epidemiology and public health; and then healthcare systems and the medical industry. And then years 3 and 4 are what we call the clinical sciences. And that's split into two parts: the medical specialties and the non-medical specialties. And in the course, it'll be very clear. We'll learn, what does it mean to be a medical specialty? What does it mean to be a non-medical specialty? Obviously, there are definitions associated with that, but there's also a kind of framework that I'll share with you. Perhaps not today because it's just a primer, but during the course. So the medical specialties embody internal medicine, which includes cardiology of the heart, pulmonology of the lungs, nephrology of the kidneys, gastroenterology of the stomach, intestines, and liver. And then infectious disease is a whole specialty, obviously very important these days. Endocrinology, the hormone system; rheumatology with the immune system and autoimmune disorders, which we will cover in the program; hematology, which is related to blood; and oncology related to cancer. And then neurology of the nervous system, the brain and spinal cord and the peripheral nervous system; obstetrics and gynecology, namely women's care; pediatrics, the care of children; and then the non-medical specialties, which are roughly under surgery, but there are other non-medical specialties, including anesthesia and the surgical subspecialties, neurosurgery, radiology, and psychiatry. So how is this mini MD or mini medical school different from a real MD? So a real MD is 4 to 6 years. And it involves in the anatomy class a cadaver. Cadaver is a deceased person, which the students dissect. Exposure to patients in the hospital, particularly the 3rd and 4th years. The real MD is very fragmented. You'll get a cardiology lecture here, maybe even only a small segment of cardiology. The next hour, you'll get a biochemistry lecture, and then the next hour, you'll get a microbiology lecture, and so on and so forth. It's quite fragmented. The emphasis is on memorization. Also, a real MD is a process of professionalization. Obviously, doctors have to learn how to work with patients, how to act professional ethics. And while we will touch upon those topics, this mini MD is not designed, of course, to turn you into a doctor. And of course, the real MD is very detailed. And we contrast that. The mini MD is over 2 days. In the online version, it's 5 days. We are not going to dissect a deceased person, so please don't worry. We are not going to see patients, obviously. But in contrast, it will be a very integrated program. It's not fragmented. It won't be memorizing, but it will be conceptual. And it'll be for a lay or non-professional audience or non-medical professional audience. And instead of a detailed view, it will be an overview. So let me share with you a painting, one of my favorite paintings from the Museum of Modern Art in New York. And it's a Matisse painting, Henri Matisse, one of the French impressionists, dating from 1911. And the title of the painting is L'Atelier Rouge, or the Red Studio. And this is a painting of his studio. Now, what's very interesting about that, it is not a photograph and it is not extremely detailed, but it does highlight those things that the artist, namely Matisse, thought were really important. They highlight the fact that he had this vase here with some plants, his chair, some of his paintings. He selected certain paintings. He also highlighted he has an empty frame here. He has a glass and some cutlery and pencils here. These are what he considered the essential conceptual representation of his studio. He didn't, reproduce every molecule or every atom of the physical reality of the studio. He presented the artistic or conceptual reality. And he famously wrote, L'exactitude n'est pas la vérité, which is French for exactness is not the truth. And in fact, we're not going to be doing, an atom or atom molecule by molecule detailed knowledge of everything in medicine. We are going to strive to be like Matisse, to pick out the essential areas that give you the feeling and the concept of his studio, or give you the feeling of the concept of medicine. So there are two aspects to medicine: the language of medicine and the logic of medicine. Now, many of you might be familiar with medical terminology courses. This is not a medical terminology course. I'm not going to go through all these words and say anatomy is this, physiology is that, and etc. That's not the purpose of this course. But that being said, medicine has a language, and we will cover some of that. I'll give it to you straight. This disease is almost impossible to pronounce. So we'll obviously learn a fair bit of terminology in the program. But there are systems. For example, there's a system out there called SNOMED CT, which is the most comprehensive, precise, multilingual health terminology in the world. It's a system of medical terminology. So we don't need to memorize that. There are systems out there. It's important for us to understand the concept. So there'll be some language of medicine. But again, as I mentioned, it is not a medical terminology course. Then there's also the logic of medicine. And this is extremely important. And the course will cover a lot of this logic. Some of you are familiar with yin and yang. That is a very Eastern philosophy that existence, life, the world, reality, etc., has opposites. And these are complementary opposites. They may not necessarily be good and evil. They may be male and female, or etc. There's sun and earth and so forth. So these are a philosophical view of the world. And I believe this duality concept is very prevalent in medicine. So this is a little bit of a complicated graph, but by the end of the program, it will be very easy for you. But this is a graph of how doctors will study pulmonary diseases, pulmonary being lung diseases. So they will do a test called a pulmonary function test with a tube and how the patient is breathing. And they will measure two parameters. One is the lung volume, which you can see on the horizontal axis, how big the lungs are, how much air is going in and out. And the second one is the flow rate, how fast the air is going in and out. The normal case is related to this, where there is lung volumes averaging around 6 liters and so forth, and a flow rate that peaks around 8 liters per minute and so forth. So that's kind of the normal case. And when doctors, pulmonologists in particular, but doctors in general, look at lung diseases, they think two kinds of lung diseases. One is called obstructive diseases, and the other one is called restrictive diseases. Now, the purpose of this slide is not to go over that. There will be another section that will talk about what that means. But obstructive diseases are characterized by large lung volumes and low flow rates, and restrictive diseases are characterized by small lung volumes and low flow rates. And they both lead to problems, obviously, because they're not normal. But this is the point. This is the yin and the yang. The pulmonologist, when they see an array of symptoms, they see someone has a lung problem, their logic kicks in and they say, is it an obstructive problem or is it a restrictive problem? Now, a little bit of this is vague right now, I understand, but I just wanted to emphasize that this is the kind of logic that recurs throughout medicine, not just pulmonology, but medicine in general. And so in the case of lung disease, the switch comes on and they say, is it obstructive or is it restrictive? Now, in the course, I will have this yin and yang diagram that will highlight these dualities. So for example, if I had the heart attack, we can ask, is it a ST elevation MI or a non-ST elevation MI? Again, those are technical terms, but they have very different implications. One is heart muscle is dying, which was the case in my case, and one in which the heart muscle is not dying. And there's different treatments and different approach to those. And this is very common throughout medicine. So one of the things is if we want to combine the language and logic of medicine. So one of the concepts is there are hundreds, thousands of diseases out there. And one major concept is that all pathology being some problem with some physical problem with the body, pathology is the study of diseases. All pathology, all diseases arises from one or more of the four types of general pathology. So let's go through those. The four are inflammation, repair, neoplasia, and degenerative disease. So if you take any disease, cancer, COVID, injury, trauma, multiple sclerosis, whatever it is, it will have characteristics of one or more of these forms of general pathology: inflammation, repair, neoplasia, degenerative disease. And inflammation is the response to injury. Repair is the response to injury. Neoplasia means new growth, so you can imagine it's important in cancer. And degenerative disease is some form of degenerative process, such as arthritis, osteoarthritis, breakdown, getting aging, and so forth. One of the most important types of general pathology, of course, is inflammation. Inflammation, also you've seen the term itis, such as laryngitis or bronchitis. So these refer to an inflammatory process, is the generalized response to inflammation. So you can have meningitis going from top to down, which is inflammation of the covering of the brain. You can have encephalitis, which is actually inflammation in the brain. Laryngitis, which is in the throat. Pharyngitis, which is also in the throat, but higher up. Rhinitis, which is inflammation of the nose. Otitis media, inflammation of the ears. Bronchitis, inflammation of the bronchi in the lungs. Gastritis, which is inflammation of the stomach lining. Cholecystitis, inflammation of the gallbladder. Hepatitis, inflammation of the liver. pancreatitis, inflammation of the pancreas, glomerulonephritis, which is inflammation of the kidneys, a particular portion of the kidneys, cystitis, inflammation of the bladder, arthritis, inflammation of the joints, and cellulitis, which is inflammation of the skin. Of course, there are many other varieties. So this is a big, long list, but they're all unified by the fact that they are all inflammatory processes. And we will talk about these inflammatory processes, what that means, what are the implications, how is it treated, and so forth. So medical terminology can be tricky. As I mentioned, cellulitis is inflammation of the skin, typically from a bacteria. So the inflammation is a response to the bacteria. So here's a picture of cellulitis, and this is the bacteria in the skin. So you get this reddish, warm, swelling, skin tightness from the cellulitis. You can see the redness there. But some of you may also be familiar with the term cellulite, right? Cellulite is this cosmetic issue. Most people think of it as a cosmetic issue. And this is the normal skin, and the fat builds up, and the dermis, which is, we'll talk about what that is. It's kind of the layer of the skin that gives some strength to it. The dermis gets less, and so you get this dimpling, which is cellulite. So cellulitis is obviously not the same as cellulite. So I'll ask a question to the audience. Remember the 4 areas of pathology I talked about: inflammation, repair, neoplasia, degenerative disease. I told you that cellulitis is an example of inflammation. Which of the 4 do you think cellulite falls under? Anyone want to venture a guess? So the 4 categories are inflammation, repair, neoplasia, which is new growth, and degenerative diseases. Where would the cellulite fit? I couldn't hear that. You can also, in the chat room, let's check the chat room. So I'll type in the chat room here. Inflammation, repair, neoplasia, or degenerative disease. So we got a couple answers. Okay. And Funda Beckar says degenerative disease. And that's actually correct. Now, of course, as I emphasize, most diseases have some combination of all of these things. But what is the primary process? As I mentioned, inflammation is the primary process in cellulitis. It's this redness, inflamed as a result of the bacteria. But remember, I mentioned the dermis, the tough layer of the skin, getting thinner. I specifically did not use the word degenerating because I didn't want to give it away. But that thinness of the dermis, this underlying layer, and the weakness is a form of degeneration, degenerative disease. It's breaking down, and therefore, as it's breaking down, you get the dimpling of the appearance on the surface. So cellulitis, which sounds similar to cellulite, is an inflammatory process, and cellulite is a degenerative process. So thank you very much for the answers. Again, there's no, I don't want to, this is not a test. It's not like a quizzing. I think the important thing is to be thinking about it and starting to, by the end of the program, really having a powerful way and framework to understand these things. So in the program, I'll cover a little bit of it today, but throughout the program, I'll also be including aspects of SARS-CoV-2 and COVID-19. So for example, how do we diagnose COVID-19? And I'm not just gonna go through the protocols, I'm talking about the conceptual aspect of COVID-19 diagnosis. How does it relate to breathing? We hear about those breathing problems. Why is COVID-19 such a problem for breathing? How do we classify viruses, and what are the implications of that classification for vaccines? In fact, anybody who's taking the mini MD will understand that the vaccines for COVID-19 are probably not going to be a permanent solution. And that stems directly from what kind of a virus is COVID-19. Now, I'm not trying to scare people. I think vaccines will be helpful, but we'll learn why it may not be the definitive solution, only solution. We talk about vaccines, we talk about inflammation because it is a injury to the lungs. Transmissibility, mortality, ACE2, it's a protein in the lungs and in the cardiovascular system. Why do COVID patients have these problems with heart rate and blood pressure and so forth? Adult respiratory distress syndrome, many of you might have heard of it. What is that? It's actually nothing really new, but this is a X-ray of adult respiratory distress syndrome. How is COVID-19 transmitted? How does it relate to the flu and so forth? We'll cover a lot of topics. This is not just a COVID-19 program, of course, but throughout the mini medical school, we'll be discussing COVID-19 and much more. So a brief warning. This is, as I mentioned, the introductory to mini medical school. And the warning is medical students' disease. So I remember when I was in medical school, and many other doctors will remember, medical students' disease is a condition frequently reported in medical students who perceive themselves to be experiencing the symptoms of the disease they are studying in fields of impending doom. So the mere knowledge of the location of the appendix transforms the most harmless sensations in that area to symptoms of serious menace. So throughout the program, you'll be learning about the disease and say, oh, I have a headache. Could I have a brain tumor, or I have a chest pain, etc. So that's a kind of warning, if you will. That doesn't mean you have these conditions, but medical students go through this experience. So here's a patient lying there. I see you've been reading the medical dictionary again, Mr. Rowden. And when I'm feeling sick, I Google my symptoms and usually find out I have cancer. So obviously a little bit of knowledge is not so good as medical students are learning. That's why they call it second year syndrome. But so I just wanted to give a little warning of that. But obviously, as we see the greater context, everything will make more sense. So this is the end of the introductory. And based on that caveat, I tell the participants, shall we start? And everyone says usually, obviously, yes. So this is now coming up to the second part of the program. I wanted to take a very short time for questions or comments on that introductory segment. And then I'll give you this sample of one part of the mini MD program, not just the introductory part, but one of the content parts. Any questions, comments?
Dr. Ogan, actually, Don Felboom is already here. Maybe he wants to say something before we proceed to the
Sure.
next section.
Good morning, Dr. Ogan. Great start. I really like it. We've got a great turnout today for this session. I think as we go forward, you're going to have a lot of people very, very interested in the mini MD program that you're going to offer in January to our AmCham members and our guests. So keep up the good work. It's a great start. I'm excited, and I'll turn it back over to you.
Okay, thank you very much. Thanks, Don. Good to see you. Glad you could make it. And thank you for the kind comments.